Hi, I am Dr. Nandini Nelivigi, a senior consultant orthodontist, Director Nelivigi Dental Clinic, Bellandur, Bangalore. Today we will talk about a very interesting topic, sensitivity. Sensitivity is something that probably everybody would have faced. It is an aging process, but when this happens at a young age, it is something that worries us a lot. Now first we need to know the anatomy of the tooth, how it is made. There are basically three layers in the tooth. The outermost layer is called enamel, which is impervious to oral tissues. It is very hard, harder than your bone. The second tissue is called dentine, which is much softer. It has tubules in it which carries the nerve endings. And then finally the innermost layer, which is called the pulp, which carries the blood vessels and nerves. Now enamel surface covers only the coronal portion or the crown portion of your tooth, which is seen in your mouth. Whereas the root, which is inside the bone, is not covered with enamel. It is covered by another substance called cementum, which is not as impervious to oral fluids as enamel is. So when a good amount of enamel covers your tooth surface, you have absolutely no problems of sensitivity. That is how you don't see problems of sensitivity in teenagers. Now as we keep aging, what we do is many things can happen. One, you're using a very hard toothbrush or using a lot of pressure to brush your teeth and you have eroded or removed quite a bit of enamel. Second thing is you're consuming a lot of acidic food, like say eating a lot of citrus fruits or a lot of lemon in your food, things like that. Third, you're taking a lot of soda in your everyday fluid intake, like say drinking a lot of Coca-Cola or Thumbs Up or whatever. So these things can cause a lot of abrasion of the enamel. When enamel surface is lost and the second layer of dentine is exposed, sensitivity becomes an issue. So when you go to the dentist, the first thing that they will see is whether any particular tooth, one particular tooth has a lot of cavity or a lot of decay or a lot of loss of enamel surface. If that has happened, it can be filled with probably a glass ionomer cement or a composite restoration, and this helps reduce your sensitivity. If sensitivity is generalized, happening on almost all of your teeth, and it is not very severe on any particular tooth, then probably your dentist will recommend you to use a desensitizing toothpaste. Any desensitizing toothpaste has a low content of abrasive in it, so when you use that toothpaste to brush your teeth, it does not abrade more of your enamel. So it helps conserve your enamel, and two, it also helps formation of reparative dentine, secondary or tertiary dentine, in which the tubules are formed in a different direction. Thereby it does not conduct what is happening in your oral cavity onto the nerves which are present within the pulp. So that also reduces your sensitivity. There might be situations wherein you have a tooth decay, a cavity that is formed which is very deep and close to the pulp, wherein you may be having sensitivity. So in those situations you may either require a filling, or if the cavity is very deep, maybe you will require a root canal treatment and capping of the tooth. Many a times it so happens that one is unable to distinguish between sensitivity, a very severe sensitivity, and a mild pain. Both of them are more or less the same. So in certain situations you may need to visit the dentist for him or her to have a look at your teeth to decide what exactly is the problem. So generally, if you try to maintain a good oral hygiene, do not use very hard or medium bristles. Use a soft bristle brush. Brush gently and brush twice a day. Rinse your mouth nicely after every meal. Do not consume any soda drinks, or do not take a very high acidic diet, or do not brush your teeth soon after you have a meal. If you follow these rules, you can try and prevent any kind of cervical abrasions happening on your teeth, thereby maintain a good oral hygiene and prevent sensitivity for a very long time. I hope this helps. Thank you so much.